to questions to start out. Star 2 will unmute your line. Craig, Alex, Joyce, Kyle, anyone on the phone line as well who's now able to attend the webinar portion. Let me know if you have any questions before we get started with my thoughts.
We're in our second. We participated last year in the population health, and so what I'm looking is kind of how to build out from what we did last year. And I've got our last year's plan up. So that's what I'm kind of looking for ideas and just different ways to approach this.
Yeah, absolutely. Do you want to read a couple of your activities and we'll just kind of go through those? Welcome, Trish.
Oh, from last year?
Yeah, that way I have an idea what you've got on the action plan, and then maybe we can work toward those or ideas.
What we did is we talked at our Flex Advisory Committee forum on value-based care, population health, global budgeting, and kind of got some feedback from them, what supports need to be in place for CHS to explore this option. And then we had a debrief on that, and then we're going to have Stratus Health do an assessment of where we are right now on population health. And
statewide,
that was delayed.
Oh, okay. That is currently delayed?
Yeah. And that's kind of where, I was looking for other ideas, and then we're going to have readiness tools, technical assistance, to cover that. So that's where we are right now on, Stratus Health, we contracted with them through the Flex program to, and I'll get in contact with them. I haven't been in contact with them in a little bit here because of COVID's kind of shuffled things around a bit. And so but that's where we're at now, and then I'm kind of looking at how to build out from that, and what other states are doing, and seeing if there's any ideas there.
Awesome. You guys have gotten some plans in place, and then the pandemic stuff kind of slowed some of that stuff down. Have you been in? And I think I heard you say that you need to touch base back with Stratus.
Stratus.
I'm sorry. Yeah, Stratus.
Yeah.
To kind of see where we're at on. Okay, so now we did have delays, but what do we do to get back on track? Can we do some of these assessments or reach out virtually or what have you to get our needs assessment completed?
Yeah.
Okay.
And the needs assessment, is that the community health needs assessment? Is that for this project?
Yeah, that's what I'm thinking of, is the statewide kind of population health, value-based global budgeting, that first thing that you talked about. Just kind of getting the lay of the land, getting an understanding of where, and you're here in Minnesota, correct, Craig?
Yes.
Yeah, so getting an understanding of where the 70-some hospitals are, I guess really what that standard bell curve looks like. There will be some way out there on the right who are really involved and doing great stuff. I'm thinking of New Ulm as an example of a hospital that I can think of off the top of my head that might be participating in value-based purchasing. And then there will be some that have no plans to do so. I think that makes sense to have a first kind of stage. When I was looking at the action plan prior to this meeting, Andy and I were looking at it, and a lot of stuff kind of came down to that basic assessment throughout the state of understanding what the current state of the state is. So
yep.
I think that would be my first recommendation for most people in states, is just to understand of your hospitals, how many are participating, and then not just participating, but I think there's an opportunity within that assessment, depending on how you do it, which could be difficult, understanding where their current understanding, for my inability to find another word, finding out where your hospital's current understanding of value-based purchasing, global budgeting, group purchasing, all of those different things. So not only of your, say, 80 hospitals, how many are participating in value-based purchasing, but how many, or where are they in their understanding and interest in receiving TA? Are we helping them review contracts and provide support? That's a different level of TA from your contractors than basic understanding of value-based reimbursement models.
Yeah. Yeah, I don't know if we've reviewed contracts. We've never done that. That would be. Does some states review the contracts, though, or?
Say that one more time.
Does TASC do they review contracts for providers?
We would be able to help review some of your contracts and measures and outputs for your financial consultants and things like that, and be able to say, oh yeah, Craig, this kind of looks like some of the other ones that we're looking at. Hey, you might want to try some of these evaluations and things. But in theory, your contractor, your financial and operational contractor who's helping you do those assessments, would also be able to provide some structure or some guidance in what some of those contracts might look like and what hospitals ought to be looking for and paying attention, and that education around those.
So most are using like a CPA firm?
Yeah, so I'm thinking of Ralph was on one of our sessions here as a subject matter expert. That would be the type of thing that some of those contractors could do when you work with them closely. Say, hey guys, we have a hospital wanting to review some of this stuff. What does this look like? How does that work? That way they're able to have a trusted professional, trusted person review that.
Okay.
What other thoughts or questions do people have? Like I said, I'm able and prepared to kind of go through a couple of these activities and fill out a few, but I want to make sure we provide you guys the opportunity to answer some of the questions you have. *2 will unmute your line.
Hey, Caleb, it's Kyle from Wyoming.
Hey, Kyle, how are you doing today?
Yay, you can hear me.
I can.
Okay, so are you going to go over this action plan then? Is that your next step?
I can, and I'm prepared to go through the action, like activities and fill out some mock things, but I want to see if you guys have questions that I can help answer first.
Well, I don't know if I have any questions, but on my action plan, and this is something that we've talked about within the people that I work with, our objectives include things like we want to address clean air and clean water and food deserts. The second one is the social determinants of health, and then I've got a slash there with transportation because I've only got 3 areas. So definitely want to work around social determinants of health, but transportation remains an issue. And then for the third one, it's chronic disease for the aging population. So I've got my objectives, I think, maybe I don't, and a timeline. I don't know what you mean by partner contact. And then, as always, I need help with what those output measures look like and those outcome measures look like. So, like, that's pretty standard for me. But those are some of the objectives that we've identified, and there. That's my information. That's all. That's all I got for you.
Oh, sorry about that. So let's have you, Kyle, grab one of your one of those activities, and we can help clarify. We can kind of go through one of those and help you fill out some of these boxes and go through those outputs and outcomes as we go. How does that sound?
Okay, so with the population health, why don't we just, can we just start with the social determinants of health? We know that there are Z codes out there that capture some of this information, but I don't know who's utilizing them or if, you know, like, so let's just talk about the activity being further education around the social determinants of health.
Okay.
The activity lead is me.
Ed. Around social determinants of health. Okay. So you want to further educate your hospitals such that they're able to do something with the social determinants of health, implement activities within their hospital to help support their community, or just to educate them?
Right, right. Good questions. So let's begin by educating them on those Z codes that we know exist.
So how do I...
Or is that, maybe that's not the right place to start. So do we just start, I mean, somehow we have to collect the data on the social determinants of health to determine what activities are next, don't we?
That was going to be my first step, is how do we know, so back to kind of Craig's point of the assessment of the state, why do we currently feel there's not an adequate understanding of the social determinants of health?
Because we're not educated on them enough.
How do we verify that? How do I say to Tori or to Natalia that the hospitals in Wyoming are not adequately educated about the social determinants of health?
I don't know. What,
so that,
I mean, I would have to, so is that the activity then, is we're going to assess the knowledge
I think that's
of our...
part of one of the activities, yes. One of the objectives is to, because I think you're right, and the objective is to educate the hospital such that they're capable of implementing activities related to social determinants of health.
Okay.
But without the baseline understanding of where they currently are, we will not necessarily be able to understand where they have come, whether or not we've been successful in our objectives. Okay. So if we find a way to identify their basic understanding or their current level of understanding of the social determinants of health, then in addition to the the basic understanding, will be able to fill in the specific gaps in their understanding, therefore addressing the needs within their community.
I like it. I like it. Okay. That gives me a solid activity. Okay.
Yeah, exactly. So you got an objective, the social determinants, and then you've got at least one or two activities, identifying a mechanism for surveying the current understanding, and then from those gaps or opportunities, then you'll be able to identify the educational offerings that you put out. Those educational offerings, say it's a webinar based on, like sidewalks is a great, easy example. Without sidewalks, it's more difficult for people to walk around in a healthy way within your community. So you and I can create a webinar based on just that, just the built environment within our town. That's an output measure, and the outcome is hopefully that our hospitals are starting to work with their community to address the social determinants of health. And it can be, of our dozen hospitals or so, I can't remember what's in Wyoming, say it's 20 for argument, round number. Of our 16 hospitals, half of them currently have them, and after our webinars and our efforts in FY19 and 20, we now have a dozen of them are currently, implementing programs or working with their partners.
Okay. Okay,
and
you just helped me fill out my form.
Oh, great.
My action plan for that is.
Awesome. Partner contact would be anyone in that related field. So if you're looking at aging services, the Centers for Aging, or whomever, whatever it is, if you have a partner within your Department of Health that works on social determinants, that would be a great partner, or whomever it is. If someone else in the Learning Collaborative has already started some of this stuff, lean on them and work with them. The partner contact is just anyone who might be helpful.
Okay.
Does that seem to help a little bit?
That helps a huge amount, and I think that's a solid activity for us, and one that I am excited to pursue and get behind. I really feel strongly that we do need to have further education and understanding about what we're talking about when we're talking about the social determinants of health, and really beyond, because we do the community health needs assessments, and we're trying to work on those health improvement plans. So I feel like this is really important and fits right in with what we're trying to get accomplished.
Absolutely, and you can really tie it in really well. And as we learned in some of our discussions related to finance with Ralph and some of the Texas folks, the language you use, the phrasing really will impact how those discussions are received.
Right, it's in the language. It's so much in the language.
So, yeah, your comment of, hey, we're already doing community health needs assessment, so there's a great opportunity to roll in that social determinant stuff in there.
Absolutely. Yeah, exactly. And that is really exciting, because to look at that and then say, okay, look, your community health needs assessment has come back with transportation being a major cause. That's a social determinant of health. How are we going to address that?
Right. And to Joyce's question in the comments, and feel free to unmute your line, guys. This is it's not kind of first come first serve. We can all participate in the conversation. So Joyce, my answer to your whether or not that would already be in the community health needs assessment, the answer would be it depends. It depends on how the community health needs assessment was conducted, who conducted it, and what it involved. There's a chance that there is a fair amount of social determinants information in there, whether or not it's been understood, digested, appreciated, and then rolled into activities in such a way. Odds are it's not. Generally, it's really not being done that way. But a fair amount of the information can and should be in those community health needs assessments. And that might be a great place to start. If hospitals are already conducting the community health needs assessments in such a way that they're reviewing them, like I want to say honestly, but that's not what I mean. I mean diligently in such a way to gather activities from those community health needs assessments like we're all hoping and wishing they would. If that's being done, great. Then I think you don't need to educate that hospital on what the social determinants of health are. You need to ask that hospital what your flex program can do to help support their efforts. They've already got that part of it figured out, would be my assumption. All right, what other questions or possible activities or objectives can we go through? Like I said, otherwise I have a couple examples that I mocked up, but they're definitely no better than the two that we already gone through. Star 2 will unmute your line.
Hey, this is Joyce. Can you hear? Joyce, can you hear me? Yeah. So one of the things that Jill and I are going to meet later today on filling ours out. But one of the things that's been really interesting through this process and the other projects that we're working on about population health, everything we seem to work on is about focusing on the population, especially with this COVID stuff. Is how our other projects in our rural communities, these things just overlap, and how, we're just leveraging, I guess, if you will, of the projects, like with me, I have 3 different cost centers, and the stuff that I'm working on, it's just, working on the population of those communities. And so, it's just an interesting thing where it's, when we say the state flex program, the flex focuses in on EMS, it focuses in, of course, on the hospitals, and then the outlining clinics and all of that. So it's just this whole thing of, what I'm trying to get my head around it is that leveraging of what we're doing. As an example, just today, because we have our done very active outline to our police departments, the police departments in those in the hospital community. And so, so here, I'm going to say, trying to put that out to the police, to get them training on Narcan, because it's all about the population, right? And so it's just interesting on this process, and for me to try to get my hands around it, that when it's not just flex, it's what we're all doing and trying to, at different, anyway, I don't know if I'm making any sense, but.
Yeah, I think a little bit. I think it can be hard to differentiate between financial and operational assessments for the hospitals, but not really for the clinics, but we can do EMS stuff and population health. And when I was in Colorado, I always really tried to think about the big picture. And we did a fair amount of work related to clinics when I was in Colorado, and I always thought back to that population health aspect of the grant then, and thought, well, I can, in quotes, justify this because it is helping that overall health and well-being of the community, and that's what the Flex Grant is for. And I think the more and more, back to our original discussion of, if you have data and a reason to think that an activity related to educating hospitals about healthy food options and justifying them spending time and money to bring educators into the local grocery store to educate their community about healthy eating habits. If you have a program that talks about a hospital or your statewide need for that kind of education, and that's the type of education that you've provided to your hospitals, I can't imagine a problem with that. It's population health, it's wellness, it's engaging of the community and all of the partners. I've never seen an issue with that, and I think it fits right in line with all of the goals and missions. I think everything does come back to that assessment or that data and justifying why we're doing this way, or not even this way, but why we're doing such an activity. I'm thinking of we were just talking about the hospital, the Hopi Hospital that Terry and I went and talked to or visited. I guess it's probably been a couple years now. And they have a very different need within their community than many of the other hospitals that I'm familiar with in Colorado or anywhere else. So whatever they're focusing on, if it's alcohol and substance use stuff, it could and should be significantly different than a hospital of Scots in Hawaii.
Mm-hmm. Yeah.
And I think the population health, the diabetic population, the age of the population, all of those things, to Kyle's point, the social determinants of health. If I'm an elderly patient with diabetes, that's going to affect my health outcomes differently than if you are just don't have access to transportation and you have a different chronic disease. So understanding kind of what that population is, I think, helps and justifies activities and actions. So I think all that is in a really long way to say, I don't know how much the differentiation, how important that is, as long as everything comes back to helping the health and well-being of that community. I can see you're typing in the chat box. I'll let you. Thanks. I hope that helped. It wasn't a specific activity, but I hope it helped at least that discussion around the cooperative agreement areas. And the EMS stuff, I definitely remember thinking that with the community paramedicine, stuff like that. There's so much work, and in my estimation, if hospitals are working well, EMS is working well, outpatient clinics, long-term care facilities, if all of those things are working well as we all think they ought to, then the population health comes along with that, because then you're having everyone doing everything they could, community paramedicine, home health, discharge follow-up phone calls, all of those things can help everyone in the community, not just that one patient who we're talking about in this in an example. All right, Alex, do you have any specific questions or activities that you'd like to discuss? *2 will unmute your line. Feel free to type in the chat box as well. All right, just getting ideas. All right, Alex, great. Thank you. I'll ask Andy to put up a blank action plan template that we can type a couple examples in. Please do interrupt me, stop, argue, discuss, think about clearer objectives and activities, talk about clearer outcomes and outputs, make sure I'm helping your understanding and clarifying some of those questions that you guys have. And do know that we will be offering a half-an-hour action planning session with me if after this you feel that would be helpful. That is available to you. And it can be, it doesn't have to, we need an action plan for the Learning Collaborative, but to Craig's point initially, this can and should, please, it should connect to support your current activities. We at TASC, we try to do this all the time. When we come to your office for a site visit or you participate in a Learning Collaborative or a workshop, we always want to get an action plan out of it. This is one of our outcomes, is an action plan completed by participants. But we don't want it to stand alone and be an additional item for your work plan. We want this to supplement and support and add a little clarity and depth to your current work plan. Does that make sense?
Yeah.
Awesome. So I'm just going to do a couple activities based on the topics that we've talked about during the Learning Collaborative. So we had, our first session was focused on data, intro to population health and data utilization. So related to that, I thought a good activity or an objective would be something related to identification of how many or the percentage of my hospitals, your hospitals that are participating in value-based models. So it's really just that assessment that we were talking about. And now, having further discussed, I want to know. I want to know a bit more than just knowing. Okay, I have 20 hospitals and 10 of them are participating in ACOs. No problem, Joyce. Thank you for logging in. I hope it was helpful. And let me know if you are interested in the half-an-hour session on action planning. I'm happy to help. Otherwise, we'll see you tomorrow for telehealth. So I think beyond just identifying the percentage that are participating in value-based models, such as an ACO or something like that, I think it would be beneficial to have to maybe a bullet point of this activity would be asking where education is needed, what types of clarification hospitals need or want, something like that, because at the end of the day, having the knowledge that 48% of your hospitals are participating is not as helpful as that understanding where their gaps in knowledge lie. That way you can address those. The activity lead is generally the person in your office who's going to do that work. Go ahead. Timeline, it depends. I think creating a survey and sending it out can be done in a couple weeks. But again, if we're going to change that activity to implementing programs related on the assessment, then that timeline is going to change, or you might have a few things inside that timeline. But if we're just creating a survey monkey, sending it out to our hospitals to get a basic understanding of who's doing what and how, that can be done in a week or two. A week for them to complete it, a week for you to create it. It's not too bad. Partner contact, as we discussed, is anyone from another organization, your organization, that you're going to be working on this activity with. If you're conducting community health needs assessments and you're doing that in your organization and you don't have anyone you're working with, maybe it's all through your organization. So an output in our example, could be the creation of a survey monkey, the understanding or sending it out. If you ask your hospitals for input when developing a survey like this or an assessment like this, those could be partners as well as output measures. If you have to have meetings with your hospitals, your boss, your PO, project officer, to prior to sending this out, sending it out counts as an output measure. It's just all the things that need to be done, all the logistics of doing the activity. It's all the stuff that really has to get done, but it's not the stuff that is, like, once it's done, it's done. That's not the important part. The outcomes are the important part. So the outcomes are an increase. Hopefully, we will implement programs and services related to value-based models. So if that's a service or a program of education, if it's helping, like what we talked about with Craig, helping hire consultants to review contracts, whatever those outcomes are. If the outcome that you're desiring is that more of your hospitals are participating in value-based models, then put that in there. But let's make sure that our goal is to have more hospitals participating in value-based models. That might not be the case. Maybe we want more of our hospitals understanding clearly whether or not it makes financial sense for them to participate in a value-based model at this time. Maybe it's just understanding this is happening, and when it needs to, our hospital can and will be prepared to enter into an ACO or whatever it is. And then any notes, just clarification, things like that. What questions do we have? Does this make sense? Am I totally off base from what you guys were thinking? It sometimes does help to work backwards. Go to your outcome first. So in Kyle's example, I think that's a great one. We do want to work on the social determinants of health. We want all of our hospitals to really appreciate the impact the social determinants of health have. But that outcome is to really hope that hospitals are able to help support those needs and those efforts within their community. So if that's a free, a ride share program at the hospital can help provide or support, okay, that's great. So that's an output or an activity to implement that. But the goal that we're working on is to improve the health and well-being of our community with an eye to or an understanding of or an appreciation of the social determinants of health, addressing those things specifically to help the overall health and well-being of our community. And we'll do that by, and then I go backwards to those outputs. Okay, so how am I going to help improve the health and well-being of the community, specifically related to social determinants of health? We'll do webinars. We'll work with partner organizations. We'll do all of these things. And who will we do that with? We'll do that with our whatever groups are there. If we have minority populations that have unnecessarily high levels of X, Y, or Z, or whatever it is, we'll work with the aging, the skilled nursing facility, or the the long-term care facility or the senior center there in town, because maybe they have an increased issue related to health in our community. Timeline is when these activities for this project, for this program, will be done. Not overall, when are we going to cure our issues related to the social determinants of health. And then again, that objective is to, similar to the outcome, is to provide programs and services related to social determinants of health as identified through the needs assessment. Kyle asked how many hospital administrators understand value-based purchasing. I would say the majority do understand. There's a question as to how fully that understanding is appreciated and implemented. I think it depends on where you are, just like everything else, Kyle. I think there's a standard bell curve distribution, that there are some who are running ACOs, as we know, and then some that have no idea what it is. Another example, guys?
Yeah.
All right, so let's do one focused on aging and long-term care. So what might be an activity related to aging services, long-term care, post-acute care? Do you guys know within your state what services are available, where they are, what communities, and who you can reach out to within your state for aging services? If not, my suggestion for an activity would be to excuse me, schedule an informational interview or meeting with your state area on aging, state unit on aging. Once you know what's out there, then you can at least provide that information to your hospital. And then you're also able to understand or identify opportunities to fill those gaps in their understanding. Odds are that that entity would be super excited and happy to partner with you as a Flex program who has access to hospitals and the programs and services that they are able to provide. More than not, you're able to get them to do webinars, to speak at conferences, to do all kinds of different stuff. Those are great partners to have at quarterly rural health meetings. The example I'm thinking of is we had someone on trauma or EMS, we had the hospital association, and I also was fortunate that the surveying entity, at least the state-based one, participated in my rural committee meeting. So once every other month, I would provide lunch, and we would talk about what's going on in the state. So if the surveyors were identifying a bunch of X, Y, or Z issues that were all the same or being told to focus on different things, I could send an email out to the hospitals to say, hey guys, just so you know, the surveyors are out and going to be stopping by hospitals coming soon, and they've been seeing a lot of X, Y, or Z issue that need to be fixed. So this informational interview with your state agency on aging might help benefit in another way, identifying opportunities that the hospitals can help with as well. So it doesn't have to be a huge tectonic shift that you guys are putting into your action plan. It can be starting that relationship with one of those entities within your state who are also interested in the topic or the population's health and wellness. And the same for the outcome measure. It can just be that now my hospitals have a relationship with these areas on aging, and they're able to reutilize these services. Ask them if they an outcome can be I want half of my hospitals to have contacted the agency on aging to request resources. I think that would be an output. There you go. Thank you. Where it's an outcome, it's just not a long-term wellness outcome, where we want to have the programs and services geared toward or thought about the aging population have been considered when we create programs and services within our hospital. So and I think that helps inform our assessment as well. So it's all really, really interconnected. So if our outcome measure is an increase in our hospitals across the state implementing programs and services related to aged population, why do we think this is a necessary outcome to have? What percentage of our population of our hospitals are currently providing programs and resources that are specifically directed toward or have a thought to their aged population? Do we know that? Maybe all of them do right now, and we don't need to focus our efforts on this. We just check in on it every once in a while and provide resources. Done and done. But if 5% of our hospitals are truly appreciating that, to Kyle's point, that area of the social determinants of health, then we can help. We can provide some coaching and some TA on that. But if we don't know how many are currently providing this, it's much, much more difficult to justify activities and that effort, and it's very difficult to demonstrate outcomes. We might have increase, we might have more hospitals, but if we don't know what that baseline data was, we don't know how many more. And it's so much easier to tell Tori or Mike to say, hey, we only had 5% of our hospitals considering this, and now they're thinking about it, and they all have relationships with the areas of aging within their community, and they're partnering with their skilled nursing facility. Any questions on that? So I think it really, I think with the topics that we have with population health and the community engagement, finance, intro, mental and behavioral health integration, telehealth, I think there are great opportunities. Kind of across the board, you can have small wins. Scheduling an informational meeting with the agency on aging in your state and understanding kind of what's going on, what they need, where they're working, what they're doing in rural, how you can help, what towns where you have hospitals don't have support, which ones have great support, how you can learn that and leverage those resources for your other communities that don't. All of those seem like it would be a great opportunity with that meeting. And it's a good partner to have when you're thinking about population health. What other questions do we have? Did that help clarify some of those outputs and outcomes?
Yeah,
go ahead.
Caleb, I was wondering, can you, this one you filled out, or the one before, can you send that to us for an example, or see, I don't know if was this a new one that you did? Yeah, this. Could we get a copy to kind of format what we're doing?
Yeah, we can save this copy to Teams. This one, Andy and I went through and did a couple examples on our own before the webinar, and then this one we did during the webinar. We can post both the one that we did with a couple examples as well as this one to the Teams world as examples, and then we are more than happy to review, provide some feedback, as well as helping with it as well.
Okay. And so yeah, this is in the Teams portal. Okay.
It wouldn't be. It's currently not, but we'll make sure it's there for you. Right now, I think it's just the blank template that's in Adobe for download, but we'll make sure it's there. Yeah.
Okay, that sounds good.
Awesome. Well, again, I hope it helps. It's just a nice kind of refresher to go through the outputs and outcomes, and then, like I said, what we would be looking for an activity action plan. But yeah, just a couple things that make sense, again, for your efforts within your state, not a whole new different thing. Good, Kyle. I'm glad this helps as an example. All right, guys. Well, thank you for taking the time. I hope this helped and was of value to your time. We will post this recording to the Teams world for those who are not able to attend, and we will also make available half-hour action plan sessions individually if you guys would like to set up. Andy will be reaching out for those.
Okay, sounds good.
All right, guys. If you